So a few weeks ago, the Prime Minister gave the provinces all kinds of more money for healthcare, said, here's the money. And the provinces said, fine, thank you very much. Many people are saying that was not enough. In Ontario and other governments are saying, we need to have a modernization, a change in healthcare. Some opposition said, privatization is terrible. But that argument hasn't gone anywhere. Brian Lilley, with the Toronto Sun, writes the best columns for the Sun, is joining me right now. I said, years ago, when there was thought of this, to change the health system and to make it more efficient, and it got beaten down because everybody said, well, privatization, we can't have that in Canada. Now, are people beaten down so they accept it?
Well, I don't think they're beaten down. I think they're realizing that it's not privatization, not what Doug Ford's proposing to do in Ontario anyway.
Right. Explain why it's not, though, for people who don't know.
Okay, because in our system, we've always had, since the beginning of our universal healthcare system, we've had private delivery of publicly paid goods. Your family doctor is a private practitioner. The guy that Liberals keep putting up as the guy you've got to listen to, he's an emergency room doctor who became a politician. Guess what? Prior to him becoming an MP or MPP, his sole source of income was from the Adil Shamji Private Medical Corporation. I think that's the full name of it. He was a doctor who billed OHIP. That's what they do. That's what doctors do. And so Ford is saying, okay, our operating rooms in hospitals work from 8 a.m. to 3:30 p.m. That's all they will work. And it doesn't matter how much you push the hospitals, that's pretty much all they're going to do. And to do
it should be otherwise.
Yes, but to do anything more, the union contracts kick in, all the other contracts kick in, becomes very expensive. So what do? They say, all right, let's use these clinics that exist, do cataracts, do hips, do knees, do low acuity, as they call it, surgeries, through the private clinics, get them done, speed up your access to care. People don't care how they get their care as long as they're not paying for it out of pocket. This happens in France, in Germany, in the UK, in Australia, go around the world, anywhere with a universal healthcare system, they do this.
And the NDP have this lockstep. They say, well, that's for-profit medicine, but it's not for profit, is it?
Well,
they're paid the same if there's a private clinic as a doctor working for that clinic or working for a hospital.
I can only tell you on cataracts, I've got the numbers on that. A private clinic doing cataracts will get $605 per cataract surgery. Hospital?
I'll get more.
$657. The not-for-profit Kensington Institute here in Toronto gets even more. So, it's costing more in the public system than contracting it out to the other guys who say, yeah, we can do it, don't worry about it, and it's not going to take away anything from the current system.
The Canadian people know better than the NDP. Brian Lilley, thank you very much. That's my statement. 3 minutes. Thank you for contributing. We are almost out of the hole. People like the show, and we want to keep it on the air. So, press subscribe. Press PayPal. PayPal is really simply a credit card that you can pay with. And if you're writing a check or a letter, please put your address in, because I will send a letter to everybody who contributes money. Subscribe, PayPal. Thank you.